What questions should patients be asking their provider about a proposed treatment plan?
Yeah, I think because myeloma therapy is so nuanced and much of this is still, in clinical trials under investigation about what to do with some of these results, I would say, as a whole, it's important to know which tests the physician looks at, to determine how you're doing, and kind of what their assessment of that result is. So, for example, if somebody has had a 50% reduction in the amount of the abnormal protein in the blood, is that sufficient? Or should we be aiming for a number that's much higher than that? Some of that depends on kind of where they are in their treatment course, but that's a very sort of reasonable question, to ask your physician is that where do you see my response now, let's say 6 months into therapy, and is this adequate? And, what is now after that we have all this information, what is my roadmap going forward to try to keep this disease in check?
Yeah, well, that's great advice, Dr. Nadeem. Thank you. I'd like to turn to self-advocacy, Dr. Nadeem. Why is it so important that patients engage in their care and treatment decisions?
Yeah, as I mentioned, myeloma therapy is so individualized now. And, we can sit here, look at the trial data, get very into the weeds and technical about, this therapy with this approach has X or Y higher response rate or MRD negative rate. But in reality, we're dealing with people, and we're dealing with people that have lives, they have, all their priorities. And until you share that with us, it's very difficult for us to know exactly what's important to you. So what I may consider to be, kind of the quote unquote best therapy for you may not make sense for you because of, all the priorities that you may have. And I think it's so important to advocate for yourself and not be afraid to bring that up to your physician, because I think many patients kind of hold that stuff in for a long time because they don't want it to impact their care. But I would argue the other way around. Tell us exactly what you prioritize. Tell us if you can't be out of commission for work for X amount of time because of a stem cell transplant. We now have options. Now have options for patients because of all these, amazing new therapies for myeloma, and we can come up with a very individualized treatment plan for you based on your priorities.
If a patient is feeling like they're not getting the best care or they're uncomfortable with the care they're receiving, what steps should they take to change that?
Yeah, I think that's very difficult because, this is a complex system. Medical systems are getting even more and more complex. They're busy. Everybody's busy. Busy offices, labs, radiology. We're all feeling that. It doesn't matter where you are. So I think it's important to raise those concerns, number one, to your practice that you're being seen at, because they would like to see that feedback, right? So kind of seeing what is something that they can perhaps improve upon. I think it's always important to, like we just said, to advocate for yourself and raise some of these issues and not be afraid of that. We're all in this together, right? So I think ultimately we're all trying to take the best care of you, and we would need to know, which part of that may not be working so well.